I'm Dr. Ramon B. Gustillo, Professor of Orthopedic Surgery at the University of Minnesota. My professional life has been dedicated to the management of fractures. We shall discuss the choice of treating femoral and tibia shaft fractures between nailing and plating. In order to address this problem or make the choice between these two types of treatment, we have to look at the biomechanical principles of nailing versus plating in the treatment of shaft fractures of both femur and tibia. In general, nail is what we call a load-sharing device. On the other hand, plating is a load-sparing device. So it's load-sharing versus load-sparing device. In a load-sharing device, the bone is stressed and loaded and therefore does not have stress shielding on the bone. On the other hand, in plating, it's a stress shielding device and the bone is not loaded. The effect of this in that the bone underneath the plate loses its density and strength. And on the other hand, in nailing, the strength of the bone and the density of the bone is shared or is preserved. What happens is, when you remove the plate, for instance, in the treatment of femur or tibia fractures, the cortical bone underneath the plate is very weak and can fracture easily. On the other hand, when you remove the nail, the bone where it's being treated does not lose its strength. It's still the same as before. That's why the incidence of refracture following plate removal is very high as 20 to 25%. The incidence of refracture following removal of the nail is less than 1%. As one can see in the x-rays, after removal of the plate, there is a marked loss of bone density of the bone underneath the plate. On the other hand, in the nail, when you remove the nail, the bone density is preserved and it's normal. Recently, there is a resurgence or there's an appearance of what we call lac plating. And this seems to compete with nailing. Still, the principles remain the same. Lac plating is stress shielding. Nailing of any kind preserves the bone and is load sparing or bone sparing. The other thing that it does in plating, it destroys the periosseous blood supply, which is the main ingredient for fracture healing. On the other hand, the nailing destroys part of the nutrient artery inside the bone, which does not affect fracture healing. Almost always, plate has to be removed and is accompanied by a high fracture rate, varying from 20 to 25%. Rarely, or less than 10% of the nail has to be removed. And even if the nail is removed, there's a very low incidence. In fact, it's rare to have a fracture following removal of the nail. The other advantage of nailing is that it allows the patient to bear weight after surgery. On the other hand, plating, you have to wait until the fracture is healed, which will be about 3 to 4 months. Lastly, lac plating is more expensive than nailing in both of implants as well as the expense of surgery, because plating almost have to be admitted to the hospital twice. The time that you apply it and the time you remove it. If you have to summarize it, what is the preferred treatment in femoral shaft and tibia fracture? First, the union rate following nailing is very high and better compared to plating. Second, the incidence of infection is much lower in nailing than plating. The reason for this is in plating you have to expose the fracture site and you have a large space or large wound area that has to be closed and exposed to bacteria as well. The third reason is that refracture is very high in plating versus nailing. Our study shows, including my own publication, it's about 20 to 25% refracture when you remove the plate. And lastly, the cost of plating is 2 times more expensive than nailing for 2 reasons. Because of the implants alone, plus the fact that it requires another or second hospitalization for the removal of the plate. And if you include the high incidence of infection following plating, that really is much more expensive than nailing. If I have to summarize, there's no question the preferred treatment of femoral shaft and tibia fractures is intramedullary nailing and not plating.